Next presenter joining us here, Dr. Sheng Chiong, Active Projects Development Category, and this is the ODocs, Ophthalmic Docs Eye Care, using mobile technology to create a low-cost system that brings standard ophthalmic equipment to the hands of all primary care providers to reach those living in the most remote regions, even outside of Gisborne.
Thank you. This is a 5 seconds countdown. Every 5 seconds, a person goes blind. Every 60 seconds, a child goes blind. The best estimates we have is that there are 40 million people around the world who are blind. One of the major challenges lies in access to standard eye equipment. The standard eye examinations consist of 3 main steps to pick up more than 90% of ophthalmic conditions. Step 1, checking a person's vision. Step 2, examination of the front of the eye. And step 3, examination of the retinal. And the equipment shown in this slide here cumulatively costs about $37,000. It is not just a problem in the developing nations, but in the developed nations as well. You don't see this equipment readily in every primary care centers. So it becomes a challenge to the clinicians to make the appropriate diagnosis without the appropriate tools. Here's a research done in Auckland just about 6 years ago, a publication. And there are some shocking truths that I'd like to share with you. Among all the referrals to the acute eye clinic in Auckland, only 68.9% of GPs offered a provisional diagnosis. And out of those provisional diagnoses offered, 43.5% turned out to be wrong. Unfortunately, we have no data on how many percentage of the patients actually received the wrong treatment and subsequently went blind. Another study done in Canada reviewed that 80% of GPs admitted that they are not comfortable treating patients with eye problems, and I'm not surprised because I myself, we spent only about 2 weeks in the eye clinic when I was a medical student. And old tools and inefficient referral methods are not helping as well. The direct ophthalmoscope, which sits in almost every clinic, was invented about 200 years ago, hasn't really changed since. Referral methods such as using fax, phones, ladders are just not quick enough and inefficient. We don't get enough information that we need to make the appropriate decisions on triage and treatment. So my objective is to come up with a system that has 3 main objectives, the 3 A's, that's what we call it: an affordable, accessible, and accurate system that makes eye examinations and referral a lot more efficient and affordable. We decided to use cell phones because 95% of healthcare providers actually has a smartphone. And there are actually more people around the world who have access to cell phones than actually clean water or toilet. So our solution, step 1, examining a person's visual acuity, we've created a multifunctional app that allows us to do just that. The examination takes only an average of 30 seconds per eye, and you'll be able to find out the person's visual acuity with an automated algorithm. Step 2, examination of the front of the eye. We've created an adapter to replace the conventional slit lamp microscope. This adapter comes with multi-optical filters, allows us to examine the eye with different illuminations, and gives us up to 10 times magnification. Shown in this video here is a patient with a large corneal epithelial defect. Step 3, examination of the retina, which is one of the most challenging procedures for most clinicians. We've created a device that can be clipped onto a smartphone and gives us up to 40-degree field of view. Shown here is a patient with a central retinal artery occlusion. And this patient here has a central retinal vein occlusion. You can see the entire macula, the disc, and this lady here has got a detached retinal. And on top of that, we've incorporated an e-referral system into the app. So the information can be presented in a structured and systematic manner. When I get a referral, I would like to know demographic information, basic histories, medications, and if I have a photo, that would be excellent. A photo is always better than just talking over the phone trying to describe a condition which you haven't seen before. A photo is worth 1,000 words. So in summary, have we achieved what we set out to do? The 3 objectives that I mentioned earlier. I think yes. We managed to squeeze the cost down to about $100 versus $37,000. That is on the assumption that if you have your own smartphone. We're also running a pilot trial involving about 50 patients based in Gisborne, comparing the results that we've taken on our system versus conventional equipment. And accessibility remains the major challenge. There's no point creating something and no one else can access or use it at all. We wanted this device to be in the hands of not just hundreds, but thousands or potentially millions of healthcare workers around the world. To do that, we've made the designs open source, 3D printable, and telemanufacturable. Essentially, that means that someone could just download the files and reproduce the entire system in the matter of hours. So within 5 months of soft launching the system, we've received about 5,000 global users all around the world. We've got pictures and feedbacks all the way from UK, Ukraine, Russia, South America, and South Africa. It was recently, just about a month ago, was presented in the Pan American Congress in Colombia as well. So I believe this is not just about eye care anymore. We're at the dawn of a revolution of the way we think about medical innovation, caring, and sharing. Let's innovate to improve the quality of life, and let's innovate to save life. Thank you.